are thought to come mostly from the lower end of the esophagus. That's the lower end of the gullet. And conventional thinking has been that these symptoms are related to some kind of problem like an inflammation or ulceration or some other abnormality of the lower end of the esophagus, that's the gullet. And it has been thought that this has largely been due to a reflux of acid from the stomach into the lower part of the esophagus, causing this inflammation or causing these symptoms then to be felt by the sufferer. Actually, our understanding has shifted quite a lot in the last few years. It turns out that everybody, all of us, everybody in this room gets reflux. That's normal. And the difficulty is in deciding what the symptoms actually mean. So in a small proportion of people who have these symptoms, and I stress that only in a small proportion of people who have these symptoms, the problem is due to inflammation or some kind of damage at the lower end of the esophagus. In the majority of people, there is no visible abnormality or no visible damage which can be dealt with. The majority of people have a normal finding if they have a gastroscopy, even if they have symptoms. So this opens a big question. Where are the symptoms coming from? Now, often the word used is that there is high level of acidity or an abnormal level of acid going into the lower part of the esophagus. In reality, most people, the vast majority, absolute vast majority, have normal levels of acid in their stomach. So somehow the lower end of the esophagus becomes sensitive to these symptoms and the brain picks up these symptoms. And the lining of the esophagus becomes such that even a small amount of food and other things in the stomach splashing into the esophagus through the valve, we call the valve the gastroesophageal junction, that things, mainly food, but other items as well as acid, of course, from the stomach will splash up into the esophagus, and that may be causing symptoms. And yet, surprisingly, in many people, tests have shown that there's no correlation between the symptoms being felt by the person and the amount of splashback from the stomach. So this is a condition which has in many ways defied our intellectual capabilities. It's clearly not due to acid alone. This is the new advance, that in fact we now feel that the majority of people who get these symptoms are getting it because of oversensitivity of the lining of the lower part of the gullet, as well as, of course, the consequences of items from the stomach splashing into the gullet. This means, of course, that if we had some kind of medication which can deal both with the acid as well as some protection of the lower part of the gullet, and that would be a wonderful new medication to have. Something that avoided or prevented the level of splashback from the stomach into the esophagus, neutralizing the acid or providing a protective barrier, and also therefore protecting the lower part of the esophagus so it becomes less sensitive. Now that would be a good medication. And the research information that we have indicates that something like Gaviscon Double Action seems to be able to do that. So this is the new finding and the new medication, you might say, in response to those new findings. I don't know how you would...
Reflux is a condition where gastric contents return up the esophagus, and this elicits symptoms. The most common symptoms are heartburn and regurgitation. It's a chronic condition. It tends to occur after meals of certain characteristics. It tracks with obesity in the population, and it tracks with emotional distress to some degree.
Dealing with these symptoms means that you need at least a two-pronged attack. One, some means of neutralizing the acid that may be causing the symptoms and causing a sensitization of the lower part of the esophagus. And secondly, some form of protection for the lower part of the esophagus, either by preventing the reflux back of stomach contents into the esophagus, or by protecting the lining of the esophagus. So this kind of double action would be extremely useful. Furthermore, we know that most people will get their symptoms intermittently, so we want something that can be taken on an as when needed basis, and also when the symptoms occur or during a period when they are occurring, rather than something or a tablet that needs to be taken pretty much all the time.
Reckitt as a company have been dedicated to developing the Gaviscon brand to manage reflux symptoms for over 40 years globally, and we're very happy to bring Gaviscon Double Action, which is our newest and most researched product in this therapy area, to India here, and we look forward to seeing it hopefully helping lots of consumers in India.
So, as the panel very rightly suggested, reflux is a situation in which the contents of the stomach, which includes acid and other food contents also, move back into the food pipe, which is generally witnessed by or the symptoms that are seen by many patients include heartburn and pain and burning sensation in the chest. And Gaviscon in India has been present for over 10 years now, and we are very happy to announce the launch of Gaviscon Double Action here in Chennai today. This is a product that will not only neutralize the acid but also form a protective raft to prevent the reflux from happening, to prevent the food from entering back the food pipe. Post this launch in Chennai today, we will be moving to Bangalore, Trivandrum and Hyderabad next to launch the product in these respective cities. This product, we are very sure as Reckitt India, will help improve patient care, especially for patients suffering from reflux. Thank you so much.